artificial intelligence is a discipline that became mainstream a couple of years ago, basically. AI is not something new. It's something that started almost 100 years ago. And what is changing in terms of AI is the type of algorithms that are used and the type of data.
This is the Man Up Podcast, a doctor's guide to men's health.
If you've been enjoying listening to our podcast, please hit the subscribe button on YouTube, Spotify, and Apple Podcasts.
My name is Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. This episode is titled Artificial Intelligence and Medicine, What You Need to Know. We're here at SMSNA, and we're coming at you live right now.
What's going on, guys?
So, we just want to give the intro for our next episode where we actually sat down with Dr. Gio. Justin, you want to give an introduction to Dr. Gio?
Yeah, so Dr. Giovanni Cacciamani, he is an incredible professor at USC. He's an associate professor of urology and radiology at University of South California, and he's director and head of Artificial Intelligence Center for Neurological Research. He is really leading the way. He's doing so many publications in the artificial intelligence space. He's on so many boards in the artificial intelligence space, and it was really fortunate for us to have him on and really do a great job explaining where we are with artificial intelligence, what you guys need to know about artificial intelligence, and where we're going to be going with artificial intelligence in medicine.
I mean, it's a common question that we always see. Is AI going to replace doctors? What's AI going to be in terms of from healthcare? And we cover a lot of these issues, and he answers a lot of the fears that we may have,
Yeah, and I think the real takeaway that I got is that, first off, it's no big surprise, artificial erections.
We're at a sexual medicine conference, so it's on our minds right now.
Artificial intelligence is here to stay, and obviously we need to embrace it if we're going to be around to use it. Otherwise, those, like he says in the episode, if you're not going to use it, you're going to be out in the dust on this one.
I mean, Justin and I were looking at some Google's put out there now where they can actually make this artificial intelligence podcast.
Yeah.
So maybe you won't need Justin and I in the future.
Maybe this is artificial intelligence right
maybe.
now. Who knows? But yeah, I think this is going to be, it's a great episode. I really hope you guys enjoy it. We're also making some great content here at SMSNA. We recorded several episodes in person, which we always love to do at least once a year. So really excited for this episode and all the content coming to you from SMSNA. So enjoy the episode, and we'll talk to y'all soon.
Sounds good. So today we're joined by Dr. Giovanni Cacciamani to talk about something really cool that Justin and I are really into, but maybe don't know a lot about. So, this is going to be a really great topic to talk about artificial intelligence and medicine. Dr. Cacciamani is an associate professor of urology and radiology at the University of Southern California and director and head of the Artificial Intelligence Center for Neurological Research. So, Dr. Cacciamani, thank you so much for joining us to talk about artificial intelligence.
Thank you so much, guys, for having me here.
So look, we're going to start real basic. We're going to, because I think Justin and I think we know what artificial intelligence is, but maybe we don't. So what is artificial intelligence?
Well, that's a great question. So usually when I talk to my students, I used to say that artificial intelligence is a discipline, I would say, something not really new that became mainstream a couple of years ago, basically. So the entire story of artificial intelligence started almost 72 years ago with Alan Turing, who is considered the father of the computers and AI. And his biography and his story, became mainstream after the release of the movie The Imitation Game. And the title Imitation Game was not chosen by chance, because technically The Imitation Game is the title of the first paragraph of his article, Machine Intelligence, that was published again 72 years ago, where Alan Turing was asking basically what happens if a machine can think as a human, and what happens if a machine could potentially bring and does a task like in the same way that human could potentially do. Over the past 72 years, a lot of it changed. And we know that artificial intelligence became mainstream 2 years ago. So I remember then when I was in my office, one of my students came to me and say, "Hey, Dr. Cacciamani, did you hear about ChatGPT?" So at the very beginning, I thought it was like something like Tinder or Grindr, and say, "No, man." I'm gonna be interested now for that. And they say, no, you have to check it. So we stayed in my office until 2 a.m. in the morning to testing the potentiality of this amazing tool. But again, AI is not something new. It's something that started almost 100 years ago. And what is changing in terms of AI is the type of algorithms that are used and the type of data. The more raffinate is the algorithm in predicting an outcome, and the highest is the quality of the data that are going to be used. Then, of course, it's like the recipe for having the best dish ever.
Right. So, I mean, basically that leads us to like all these different platforms that you were kind of alluding to that have, I guess, different algorithms that they've created for their AI platform for their own AI platform. So you have like ChatGPT, Bing, all these. So like, what are the most common platforms people are accessing and using AI, at least at home?
Well, this is a very timely question, because very recently we released this global survey to all the urologists, and what we figured out is that the majority of them are using ChatGPT as a part of their daily activities. From correcting the grammar. I mean, I'm Italian, as you can hear, so my grammar is not correct, but it's extremely sexy, so I'm keeping it. And so there is no AI that could potentially change that. But again, you can use it, for example, for brainstorming, for even for applying to the insurance companies when they are rejecting a patient. I mean, we know that on the other side of the phone, we have some people that are not even a doctor, and they are claiming that they can actually tell you, well, you know what, I don't think that your patient will need this kind of treatment or this kind of imaging, etc. How many times happen? Well,
All the time.
you can actually challenging them, having ChatGPT reply to them, and it's going to be a battle they cannot actually win. But it's not just only that. I mean, at the end of the day, we are using AI every time. Imagine when you are texting to somebody. iPhones or any kind of smartphone is predicting the new word that could potentially be useful for you to complete in a message or a text. Well, that is generative AI. Another example of generative AI that is 14 years that is on the market is Google Translator. Google Translator is actually the very first generative AI that was released on the public. So I would say that generative AI, ChatGPT, I would say that OpenAI made the AI mainstream, as much as now seems that everything is powered by AI, which is not true. The only thing I can say is that in terms of healthcare, artificial intelligence is, I would say, can be the perfect ally for us. We know that the number of physicians is decreasing, the population is aging, and all of those are ingredients for a catastrophic event where we are not going to be able to take care of our patients. And the main reason is because we found ourselves on daily basis to deal with, for example, patient charts, and better than me, we have slots of 20 minutes, and we are using 15 of these minutes for typing on the charts. Do you think this is good? I mean, and then you find like patients that are going to the internet to gathering information, where the pernicious strap of the fake news is always around the corner. And they're telling you that you just have to take manuka honey for having strong erections, which actually we know that, at least for now, is not proven to be like
Right.
the best way to have an erection. So, yeah.
That's very interesting. I want to plug how good ChatGPT is. I actually, when I saw on YouTube where they were like, you can have a live conversation with someone in Spanish and it's like instant translation. And I used that with a patient that spoke Korean because we couldn't get a Korean translator. And it was phenomenal. It blew me away. It was like instant. And like there was no like lag to kind of like wait to translate. It was like I was having a live conversation, which minus a real translator, that's always been kind of the struggle with like the old Google Translate, where you would show it and be like, all right, read this, and then read it back. And so it was quite amazing. Now, you kind of touched on it a little bit, but I wanted you, if you could expand on it, Gio, just how doctors or in medicine, we can use AI to really expand how we can, provide or improve patient care. How can that be done?
Okay, so the very first thing that you have to say is that AI is not here to replace urologists, but the urologists who will use AI will replace those who don't. That's the main important thing.
That's a good
And
point. Yeah.
yeah,
Love it.
and at the end of the day, AI is here to assist us. It's like a white collar that can make our life easier, to reduce the workload, improving the performance, and keeping the workflow. There are a lot of potential application of AI. The very first one that was explored, which is technically the easiest one, is the image recognition. Imagine how cool would be that using AI for reading automatically an MRI of a patient undergoing an MRI, for example, for suspicious prostate cancer. But the cool thing is that it's not only automatically reading an MRI, it's also trying to put in correlation the MRI with the potential pathology. Again, imagine to have like a system that is reading through the images, looking at the images in few seconds, and we're talking about an MRI, which is a 3D imaging, and identifying the prostate versus the surrounding tissues, identifying the suspicious lesion, and giving you a characterization of that lesion, if it's a clinical significant cancer or not. Let me give you a few numbers. The recent systematic review and meta-analysis released by the Cochrane in 2019, I think that was like the systematic review meta-analysis on randomized trial comparing target biopsies versus target biopsy plus standard biopsy. They figured it out that out of 1,000 of men with potential suspicious prostate cancer, the MRI will identify 273, which actually has clinical significant cancer. The problem is that the other 447, which technically are is when the MRI is misclassifying a non-clinical significant cancer. So in other words, we are right now in 2024 still doing a lot of unnecessary biopsies.
Right.
And technically, AI can be the perfect allies for us for reducing the necessary biopsies. Imagine how many times we have a patient that we have in active surveillance. Those patients are coming with a PSA between 6 and 10. They are coming to us. We do an MRI. The MRI is coming. We don't know. Let's do a biopsy. We do the biopsy, and we're not finding anything. The fact that the biopsy is negative is just telling you that it's negative where you biopsy the prostate.
Right.
It's not negative in the between. So, and imagine how cool it would be having a system that automatically is looking at the MRI, identifying potential area of concern, and then automatically giving you a prediction of how much will be that tissue could potentially be, for example, prostate cancer. This is like in big days, what is the image recognition. Another potential application, which is extremely important, is on surgical AI. It has been estimated by the 2030 by the Economic Bureau that the impact of AI in surgery will value 40 billions in 2030, so 6 years from now. And if you want to invest something, it's time to invest on AI and surgical AI. I'm not giving any advice, but I'm telling you that I'm going to do that. Main reason is because imagine in the same way that you go to a restaurant and the very first thing that you do is checking the reviews on Yelp, on Google. So for the same reason, I can claim that I'm going to be the best surgeon in performing radical prostatectomy, which could potentially be true or not. That depends on my outcomes, right? On how I treat my patient. So, and again, when you're asking to doctors and say, okay, do you have complication? The majority of people are going to tell you, oh, no, I don't have any complication. So my past boss, Dr. Artibani, who is like a legend in Europe for robotic surgery, was used to say that there are 3 categories of surgeons that are telling you that they don't have any complication. Those who don't know how to measure the complication, those who don't know the definition of complication, and liars. So considering that we are trying to say to everyone that nobody's a liar, it means that we don't know how to measure complication and how to collect them. So again, if we can have a system that automatically is looking at, for example, your surgery and providing you a feedback real time to you, well, technically that is going to change dramatically the way that you can address yourself. Imagine you're doing surgery and in real time you can say, oh, well, I'm not that good in the urethra bladder reconstruction, so probably I should train more on that. Just an example. Or lymphadenectomy, when I'm doing lymphadenectomy, I'm still having like positive nodes that are lived there, and I'm not taking them out. So that is an example of surgical AI. And of course, these can also be useful for evaluating the performance from the surgical perspective, comparing yourself with the average national average. And as patients, in the same way that you go to a restaurant, you find a 4.5 star restaurant, you should find a 4.5 surgeon specifically for that particular procedure.
That's going to be
Uh,
scary, man. That's going to be
yeah, I
scary
know,
world
but
when
it's
that
time.
happens.
It's
I'm
time.
not saying
And
it's the wrong thing. I'm not saying it's the wrong
yeah,
thing at all. I mean, it's a very interesting perspective there that AI will basically come up with a Google rating for you based off of your surgical skills intraoperatively. That is a very wild idea that I had not thought about yet. I don't know. I mean, but there's obviously inherent biases. It has to. I think you think we're close to that, or you think we're far away from that?
I would say that studies, specifically studies for the Motri group in Orsi, at the Orsi Academy in Belgium, they are showing that now the system of surgical AI system are able to automatically segmenting surgical videos and automatically detecting the anatomical gestures that you can actually translate and correlate with the potential outcomes. Those things together with the movements that you have in the camera, like for example, early studies in 2021 published in JROL, they are showing that
Yeah.
skilled surgeon is usually moving a lot the camera, but not moving that much the instruments. On the other side, the range of movements of a naive surgeon is keeping the camera close, but you're moving like crazy the masters. That's just an example. And then, imagine another thing. Another example is how we can improve the trials, for example, surgical trials. You can create what we call the digital twins. Right now, when you are running a randomized clinical trial, is expensive. You have to find the people that agree upon doing a trial. So technically, with all the data that we are collecting, you can create digital twins that you can compare with the people that are taking, for example, the intervention. And this will give you the chance to have a real correlation in real time and in few seconds. So you don't have to wait like years for having the results of. But those are, of course, we are not close to having digital twins, but there is a lot of movements, etc. And potential other application are on the physician side and the patient side.
Yeah, I mean, this is crazy. I mean, obviously, it sounds like this is one, like we're talking about one technology that you just listed like 1,000 things that can improve on the physician side alone. And I think that one of them you didn't mention, which is also beneficial, like you're saying, to the patient, is that in-office experience. And Kevin had already alluded to the fact that he's already started using AI to some degree, and the generative AI, we've all used Google Translate. So in one way, we have all used AI already. But, all these platforms are now coming out with, AI dictations where they're going to be helping us with our templates. Because I think one thing that we're all sick of, our patients are sick of, is that computer. It's in the room, it's taking up space. Like you said, it's taking up a lot of time. And I think we're getting closer to making it and bringing it back to that nice experience of I walk into the room, I talk with the patient eye to eye, I walk out of the room, the orders are already in based off of our conversation, the note is done, and the labs are in. How far are we away from getting back that person-to-person patient experience in the office with AI's help?
Okay, so let's start from this point. Over the past few years, a lot of efforts has been done for creating the environmental instruments and tools that can empower the experienced physician patient experience. Again, accordingly to at least the data that we have that will be published very soon, out of 20 minutes of clinical encounter, 14 minutes are used on typing on the computer. So imagine to be a patient. I have been a patient too. And when I'm talking to a colleague that is looking at the screen, just typing, just coding, and not listening to me, well, you don't feel like that you have that kind of care that you would deserve. First thing. And then, of course, you go to Google after the words, and where Dr. Google is there, and the pernicious trap of the fake news is always around the corner. That's the first thing. The second thing that we have to consider is that us as physicians, how many times you find yourself that you are going to do homeworks on Sunday afternoon to prepare yourself for a clinic that you have on Tuesday or on Monday? It happens all the time. And that is what we call work outside work, WOW. And is quantified, is defined as anything that you do outside the 8 hours of your clinic day. So now, and how many times you are closing, for example, the patient charts after 4 p.m. So why I have to use my personal time on doing administrative tasks that has nothing to do with what I studied for, which is taking care of patients or
Yeah.
talking to patients.
100%.
So the idea is changing these proportions from 15 minutes in typing on patient charts without considering the work outside the work, which is quantified 4 hours per week. And these 5 minutes that you're spending with your patient into the opposite. Why not even reducing the time for a clinical consultation, and why not going home earlier to our families, to just going to the couch? Why not, and looking at Justin using your boat and going somewhere? So I mean, so,
I wish I had a boat. I use Tom's boat. Shout out, Tom.
So the point is, I would say that we're very close. There are now different AI scribe. I'm pretty sure that you saw that, like those microphone that you're using on your phone, and technically you can use this system to writing automatically the patient encounter. Problem of that is cybersecurity. In 2019, the WHO released the governance and ethical concerns about AI documentation. And out of the 6 potential issues on AI, they find out that privacy and cybersecurity are the most important ones. So now, imagine that you are talking to a patient, you are taking out your phone, and you're putting your phone in front of them. They don't want that you are going to record them. So AI systems, AI softwares require also AI hardware that are showing, as in the same way that we have a stethoscope or an otoscope, has to be shown to the patient that can have to understand that that system will record them and will make the patient encounter better. But the real thing is not the AI scribes. At the end of the day, having an AI scribe, of course, is taking out a lot of mind energy, but at the end of the day, it's just saving 2 minutes. The real thing is finding something that is going to impact on your work outside work when you are putting together the patient charts in a way before the clinic day. So now there are a few, and this is related to the fact that, just want to give you a few numbers, 64% of physicians are in burnout. 71% of urologists are in burnout. I'm pretty sure you saw the American Association of Urology email a couple of days ago.
Yep.
Yeah.
And the majority of them are residents. They didn't even started being
It's great.
urologists
Yeah,
before they were in burnout. So, and that's the reason. And again, the reason is always the same. We have a population that is aging. The number of urologists decreasing. There is not the turnover, and this is going to become worse and worse and worse. So we have to find out systems that are doing the job for us, making our life easier. One example is there is this software. The name is One Line Health that is basically creating patient information before your clinic day. So the patient, for example, receive at the time of the scheduling a link. The system then the patient is interacting with the computer, where a large language model is predicting the new question to ask to the patient, and automatically the system is receiving also, like for example, labs or imaging. Put everything together and give you as an output a short version of what you need to know, and you just have to confirm it with the patient.
Oh my God, dude. That's the most incredible
Well, I mean,
thing I've ever heard.
nothing gets a doctor's heart rate up when the patient comes in with a stack of papers like this big, and they just kind of hand it over and say,
Right.
like, it's all in there, doc. Just get through that, But
Correct.
that would be amazing.
Correct. And coming back to your point, which is again, I'm using, for example, AI for making more understandable some concept to the patients. Let me give you something that happened to me. So 2 years ago, my fiancée, she had leukemia, And it
So
was a
sorry.
very tough period. Yeah, but now she's fine. She's Italian, so she's strong, and and on top of this, she's a woman. So two things together are basically making her beating cancer right away. But again, it was a very tough period. And again, I'm a doctor. I'm a pretty educated person, and when I have to deal with other colleague of mine, they were trying to explain to me, or giving to me like the letter of discharge, for example, after chemotherapy. It was extremely tough to read. So I start thinking, if it's gonna be so hard for me that I'm a doctor, how difficult and challenging it could be for a patient or for people that are taking care of them. So AI can be the perfect ally for summarizing very complex information into something that is extremely easy to understand. On the internet, you can find a bunch of information. You can find certified information, like, for example, AUA, the EU, etc., but are not readable. And readability is needed for understandability. And another example is, the non-certified information, where you can find, for example, they can treat, I don't know, like, cancer with baking soda, that is extremely readable, but is not certified. So, AI could potentially be a perfect ally for, patients to understand immediately if web content is certified or not. But for example, there are some platforms like one of the platforms that we developed that is, it was published in JROL a couple of weeks ago, Pub to Post, which is a system that you give to the system the abstract, and automatically the system is creating a layperson abstract that can be used, for example, for patients and for even from general practitioner, to understand if there is any trial that can be used or any piece of new publication that can apply to patients.
So I'm going to ask you a question here, because so you're I think what you're alluding to is like, there's a lot of power with these these new AI platforms that can help you get the right information. So look, AI is trained on based on what it's fed in, right? The information that's fed in kind of helps train it. So on that flip side, could you see potentially where you could actually create, the training, whatever is being put into it is actually non-factual stuff, and that platform still taking off? That could really cause potential harm, right?
That's an excellent question and very timely. I'm pretty sure that you saw the paper, the article that was published in
Yep.
New York Times a couple of days ago. They were mentioning that the AI. So right now, the 49% of the web content is generated by generative AI, and is not declared that is generated by generative AI. So now we know that generative AI tends to have hallucinations, which is defined as the AI that is giving you concept in a very sophisticated and serious way, but is BS, is not correct.
Right.
And just to mention, the term hallucination was the word of 2023, according to the Oxford Dictionary. So I just want to mention that. So again, if you have those concepts and those information that are going to be mainstream, well, that will be used for training the new generative AI system. And this is extremely dangerous. So that's why our team, together with the editor-in-chief of Nature Medicine, Lancet, you name it, they are there. We are creating the Kangaroo guidelines. Kangaroo stands for ChatGPT Large Language Model with Ethical and Accountable Use. Is basically the largest DeFi consensus ever done in academics, where we have almost 12,000 people that are going to be part of that, 195 countries, all the 27 disciplines. And we are actually working for creating guidelines on preventing what happened, for example, in the 90s with the photo manipulation. We want to make ethical guidelines on what you can use for, if you can use it. If you're using it, you have to declare it, and you have to declare how you use this kind of technology when you are writing or you're doing research or academia, etc. Why that is important? Because at the end of the day, those systems can, or this output at some point will be used for training the new system that will be biased by the information that you are providing. The other point is the type of, the version of generative AI that you're using. We are conducting this systematic review and meta-analysis, and out of the 5,000 paper that were published on generative AI over the past 2 years, 1,000 roughly 1,000, are looking at the performance of generative AI technology in replying to medical questions. They can be multi-choice questions or clinical scenarios. Now, what we figured out is that if you're using GPT, your accuracy is around 59%, GPT 3.5. If you're using GPT-4, your accuracy is 79%. But these percentages are jumping to almost 93% when you are training the system with knowledge. In other words, you can have those systems replying, using the knowledge that there is on the internet, but of course that can be led to hallucination. But if when you are asking and focusing the system, telling the system, hey, read only the guidelines, the system will reply to you with 93% of accuracy, which is extremely good. Not only accuracy, but also completeness of the information. Two systems can tell you that the blood in the urine is related to cancer, which is correct. But if you're missing of telling that this blood in the urine can be related to UTI or also stones, it means that the information is correct but not complete. And that actually is the key when comes to web information. Accuracy, readability, and completeness are like the three pillars, the trifecta that you have to consider. And that's why the new medical chatbots that are powered by artificial intelligence should take in consideration.
So, I mean, everything you're talking about is obviously so important. I remember I think you guys published that paper where you did create the algorithm for European urology, where you're feeding it the guidelines and it did improve the knowledge. I know Kevin and I have talked about this a lot. We've mentioned it on the podcast where, sometimes we'll just we're looking up a subject that we actually know well, and we'll look up a topic and it will give you publications that are actually fake, that don't exist. That's something that's always concerning that we have seen. And Kevin and I have published recently. We looked at vasectomy accuracy in ChatGPT and other platforms that we had recently published. I don't know when this comes out, but I guess probably in the last month or so. Overall, they were very accurate. ChatGPT compared to Bing and I forgot Bard was the most accurate. But I mean, I think that the question I'm going towards here is kind of what you're alluding to. Is I find it interesting now that before we were talking about fake news, then we're going to the internet where we're talking about Dr. Google. Now we're talking about Dr. TikTok and Dr. Instagram. And now we're progressing now to Dr. AI with our patients. And I think that is concerning because of exactly the things that you said. The difference between, I think, TikTok and Instagram is that when you have someone's giving you information, there's sometimes ways you can just see that they're not telling the truth, or there's an angle that you can always kind of pick off because it's a human. But when you're sitting behind a computer and you're asking a computer that you assume is smarter than you a question and they're feeding you back information, you're assuming it's accurate. So what are our current concerns, and what are the things that you recommend people who are going to AI for medical information online? What do they need to know to get the best, most accurate information through that platform?
So, very good question. So I would suggest have always the human in the loop. So in other words, you can use chatbots that are empowered by generative AI to, having some medical advices. But you have to take these advices with caution, with a grain of salt, and then you can go then to your physician asking for questions. So let me give you an example. Generative AI, or in general medical chatbots, can be excellent for triaging. You have an issue, you can have a chatbot that is we are developing one that you are interacting with, and the system can tell you, okay, I have this problem. So you have this problem. I am a AI system. So, but I can provide you with a list of providers that are close to you. So, and this way they're going to find Dr. Dubin and Dr. Chu that are going to say, okay, I can find basically the perfect provider for my issue. So that's the main point. The other point is I feel that societies should start making their own chatbots powered by their own guidelines. I mean, let's be honest. We are professional, we are professionals, we are super good. But when was the last time that you read the entire body of the AUA guidelines? When was the last time you read all the updates of the EU?
It's true.
Let me tell you, in our department, I'm leading those ground rounds because our fellows and residents every year they have to make an update on all the guidelines, so we get up to date. But it's impossible to read those thousands and thousands of pages. And on the other side, our patients are expecting we are doing that. So why not having chatbots that are power and as a knowledge they have the guidelines and they can help you to navigate through the guidelines to find the statement or the recommendation you need the most.
Well,
Again,
my question is for that, just a quick question. Are you saying that for patients or are you saying that for physicians? Because
for
obviously,
physicians, for
right.
physicians.
Because I think the realistic thing here, though, is for patients, they're going to be going to those same, the gold standard. They're going to go to ChatGPT, they're going to go to Bard, they're going to go to all these other ones. And in those situations, is there some kind of, for the patient forward here, because I'm really interested in how we can protect our patients from this misinformation on these platforms. Is there general things that, like, is it general questions that are safe about your health, or like you were saying, like, is this an emergency, like, and then you say yes, no, and then it gets really, you lose your knowledge when you're going in depth on a specific topic. Like, is there a superficiality in the AI space that in general, it's probably a bit accurate versus, when you're asking an incredibly specific medical question about, the for example, what is the cutoff for testosterone of a 45-year-old man compared to like a 30-year-old man, and what should I be getting treated versus, do I have what is the definition of low testosterone in general? Like, what is the range of what we should be trusting on these platforms?
Okay, so that is a very good question. So let's start from this concept. Before the advent of any kind of generative AI chatbot, if you want to find any information on the internet, you're typing the question on the search bar, and you, as a user, are deciding to which link you want to click.
Right.
That is adding the human in the loop, which means that independently from the accuracy of those medical information, you are the ones that can choose and can judge the quality of the information. For chatbots, the system is totally different. You are asking the question, and the system is providing you with the answer, like a dogma, without sometimes providing you even a source or providing you quick.
Yeah.
Yeah.
And
Yeah.
that actually is the point. So, and you actually, Justin, made you nail it, because that is the key. Medical chatbots first should be endorsed by specific societies. They should have like a trademark of trustness. They should they should report on which data they are trained. They should report also on the type of generative AI used. I'm part of this committee. The name is CHART. Is led by Canadian McGill in Canada, and we are like 40 experts that are trying to make the guidelines on what should be reported for the medical chatbots. And again, the point is society should take the lead of these things. We don't want like random people, being out there with the chatbots that we don't know in which data are trained. They should show that their replies are correct, complete, accurate, and readable. That is the main thing. And why not empathic? Because at the end of the day, let's put it this way, especially for men's health. How many patients are scared of going to the doctor saying that they have an issue or they don't want to share this thing? They go on the internet. We know that. So, and the again, chances are that a chatbot can provide you like with fake contents and hallucination. We did this study that was comparing basically the top four potential questions for men's health, like erectile dysfunction, perineal disease, micropenis, and then we compare the replies from doctors from Reddit with the replies from ChatGPT. What we figured out is that ChatGPT is more accurate, unfortunately, from the doctors. Well, we don't know which doctor are replying already.
Right.
That's so the ground truth is basically unknown. But the problem is that ChatGPT is more empathic, and if you're adding in the loop also the empathy, patients are going to start trusting those chatbots more than the doctors.
Isn't that
That's the
say
point.
something that robots are more empathetic than human doctors?
Hey, I want to tell you though, Justin sent this. We were using he was using Grok. We were messing around on
Yeah.
Grok, and he typed in like my name or he typed in his name, and like the way they like pulled this information and put it together just gave such a human element to the way that they were like, oh, Dr. Dubin is, if you want to really get your men's health taken care of, this is the guy in South Florida. It was just like, I was reading it, I was like, I got to see this guy. Like, I got to, I have, I know Justin, I know he's good, but, someone who's just looking at it, you get that sense of there is an emotional attachment to it, which is kind of crazy.
Yeah.
Justin, maybe we should
definitely.
start a man up chat GPT or something.
Yeah. I mean, it is quite alarming, and yeah, I think that's something that you brought up, and yeah, you're right, Kevin. Triggering that thought when I was just I guess not Googling, it's searching ourselves on Grok 2, which is the Twitter or /X artificial. It was quite wild. They know a lot about a lot of different people, and it can really be enlightening in that process, and it makes you want to believe it, even if it's good, bad, whatever it may be. It just feels very, very believable. And I do want to move on though to as you said, it's man up. I do want to highlight some men's health stuff in the AI space, which you were alluding to already, because I think especially when it comes to men's health, which is a very stigmatized thing, people go online much more than they go and talk to a doctor. So this is something that ChatGPT, all these generative AIs are going to probably play a bigger role in men's health. But how is in the space of male infertility, which is obviously something that we've discussed a lot and has been a stigmatized place, can AI help us as physicians and the patient in the male fertility space?
Well, absolutely. So again, there are several things that can be done. For example, medical chatbots that are empowering with the current guidelines that can be the perfect triaging for patients, can provide them with more confidence in what they have, and therefore making a more informed decision making, and also a informed discussion with their provider. That's the first thing. The second thing that can be used is, for example, finding the providers near you that is better, meeting your needs. And in terms of, for example, the imaging recognition, is the count of sperm automatic in few seconds. We know that it's taking time, and the system automatically can do that right away. Other stuff can be related, for example, to the prediction of fertility parameters. Right now, we know that the nomograms that are out there are not working, are outdated. And again, just talking about nomograms, in general, those nomograms are based on multivariable analysis that where researchers already thought a priori before which were the variables to be considered. So now with artificial intelligence, you can have these huge databases, huge. Look at, for example, infertility. Look at, for example, low testosterone. I remember a study that you, Justin, published a couple of years ago, maybe last year, regarding all those, services online that are going to give you basically, they're telling you, oh, you can use this testosterone, and without telling you basically even there was a huge difference, if I remember, about the parameter that should be considered in terms
Correct.
of low testosterone.
Correct.
So again, AI can be the perfect ally to patients to understanding basically if those information are correct or not. Input those information in this system. The system is fitted with the entire medical knowledge, and I'm going to tell you, yes, it's correct or not correct.
I had a patient come in who took their semen analysis and plugged it into ChatGPT. Now, again, they weren't like fully believing in it, but they were informed. They came to me like, "Hey, doc, like, ChatGPT said, hey, I got to take a look at this part of it," and it was just it can be empowering for patients when they receive these lab results, have kind of no idea on it, to at least have an idea and bring that to the table when they're talking to a physician. Because I'll tell you, that helps a lot to kind of get past that first step where we may be taking 3-5 minutes to be like, hey, these are the things we're looking at semen analysis. If the patient's already bridged that, it makes that conversation and time that we spend together that much more useful.
100%.
Well,
And I also think,
let me go further. Let me go further with one of my patients. So he's uploaded a picture of his penis on ChatGPT, and of course ChatGPT refused it. and he decided to draw the picture of his penis. The system identified that the guy has a Peyronie disease.
No way.
What?
No way.
I'm not kidding.
Was it right? Was it right though?
So I'm not kidding you. It means that the system, without any training, can understand that there is penis. So it's you show me that. So what you drawn seems to be a human penis. This curvature is not a physiological curvature. They could potentially be a Peyronie disease.
Wow.
That is absolutely insane. That's really wild. I mean, listen, just to highlight this, I mean, I'm just kind of speechless right there. Like, this thing can identify Peyronie's disease just by a little drawing. It's amazing. But I do want to highlight some of the other stuff with artificial intelligence and male fertility too, that you did highlight some really good ones. And I think one of the more important ones coming down the pipeline is you mentioned nomograms. And, for those who are, nomogram is basically a predictive model that to predict outcomes of whatever you want the outcome to be. Sometimes we use it as outcomes for determining prognosis, for determining what medications or interventions would be the best. For fertility, there isn't many for men. And when we look at the ones for men, we look at outcomes for men with azoospermia, which I think we've discussed in the past, men with no sperm in their ejaculate. And right now the data really is, we don't have a good way of predicting. We give about 50% chance of finding sperm. But, I know that there's a lot of people in the space trying to figure out ways in which we can create algorithms using AI to help predict success rates of surgery, because the one thing that's important is there's always risk with surgery. And there's also an inherent cost. A lot of these things are not covered. So people are spending a lot of money to see if they have the outcomes that they want with only a 50% chance. So, I think that these are important things that can also help in the fertility space. Now, are there any other ways in which you see in the men's health space AI really impacting any? I mean, you just mentioned Peyronie's, which, can you tell us more? Is there any other stuff about Peyronie's, man? That's crazy.
If you're gonna have anybody else uploading any kind of other picture, we'll let you know for sure. One of the things that we have is, for example, also the discovery of new drugs and new medications. AI has been found, especially deep minds from Google. They basically develop a system that automatically is predicting the folding of proteins. If you can predict the folding of proteins, technically you can create new drugs that can be used in the men's health space. Before 2021, when the generative AI was released as part of the mainstream, to predict if you want to predict the folding of a protein, it would take like roughly 2 years. Now, in less than 1 week, you not only can predict the folding of the protein, but also you can create new proteins that are not present, and therefore you can make a huge difference in the way that we can create new drugs and medication for our patients. That's for sure.
Really amazing stuff. Really amazing stuff. And Justin, on that note, also, I was really thinking about how, even for us surgeons in the fertility space using AI, a lot of it is with experience, but like really when it comes to sperm retrievals, I really do think that could aid us in identifying tubules, spaces that we should be paying more attention to really help patients kind of bridge and get to better success rates that could be limited by some sort of human nature, something that we're not seeing. Now, look, Dr. C, I'm going to ask you this question because I think it's what all patients want to know and what we in this conversation are afraid of. And I think you touched on it earlier, but just to kind of recap and go at it again, do you think AI could ever replace human doctors, or is it always be considered as a complementary tool?
The answer is no, at least for now. AI right now is trained, at least for now, AI, as I used to say, is not here to replace urologists, but those of us who will use AI will replace those who don't. And the main reason is because we have to take advantage of this technology. Again, this technology can reduce the workload, keeping the workload, and improving the performance at the highest level. This kind of technology is the perfect white collar assistant that can reduce our daily burnout. Again, this will impact dramatically in the way that we can deliver in care. If we are going to feel that we are less, into this tornado of bureaucratic stuff to do, it means that I can focus more on our patients, going home and spending more time with my family. And also from the cost perspective, imagine that you can avoid sometimes having patient coming to clinic because you don't need them to come to clinic. They should come afterwards. And technically, this impact also on the carbon footprint of the clinical visits because you are reducing the people to come into your place. On the other side, AI is consuming a lot of a lot of energy. So, I mean, that the point is, unfortunately, it's a vicious cycle. But again, there are a lot of potentialities, and us as physicians, we have to start embracing and at least testing this technology, at least having the mind open to understand that this tool is an amazing tool that can reduce our, the burden from our shoulders, and try to be more focused on our patients,
Now,
making urology human again.
Now, in the next 5 to 10 years, obviously, we're really only starting to get a glimpse of this technology in the space of medicine. How do you see AI shaping the future of medicine in the next 5 to 10 years? What are the big changes? I guess the things that you've mentioned, right?
Well, the big change is related to the fact that this technology will be on our side all the time. Again, as I was mentioning before, with a population that is aging and there is no turnover for physicians, we are literally in the edge of having a catastrophic event in healthcare. We cannot take care of all the bureaucratic stuff. We cannot take care of all those patients. And the more the population is aging, the higher is the chance that they have this population has any kind of disease. AI is here for reducing our workload. You can read an MRI, for example, in 20 seconds instead of 30 minutes. You can have the MRI having the same, imagine that, for example, a radiologist looking at the same MRI at a distance of a washout of 3 months. Sometimes he's not even able to find the same lesion, even the same radiologist. And again, if he's not even the same radiologist is able to find the same lesion, it means that more experienced radiologists will be always in the academic centers. And around, you can have those radiologists that cannot reach the same performance. So if you can train the system on the best radiologist in the world, you can have an assistant that is making you being an Avenger doctor more than an average doctor. And that actually is making the point that AI is here to stay, is futile to resist. But again, now it's time to using this technology and our advantage to providing better patient care.
I mean, this has been a fascinating conversation. Learned a ton. I'm sure our listeners have. And so we're going to wrap it up. And for our listeners who have any thoughts, put in the comments, ask questions. This is stuff that is very timely and very present in all aspects of our life. So, Dr. Gia, just to kind of wrap it up, if you could just kind of give us some final thoughts, a conclusion, or even advice about artificial intelligence in medicine for our listeners.
So the very first thing is that before talking about deep learning, we need a deep teaching as a medical community to deep understanding everything about AI. That's the very first thing. The second thing is that now AI is all over the places. Can be used from imaging recognition to trial evaluation to patient encounter and patient experience. And is our duty as physician understanding the behind the scene of AI, to understand basically not only how this technology works, but also how this technology can be useful for us. We are in a golden age. As physicians, we have to take advantage of this technology, as I was saying, to reducing the workload, keeping the workflow, and improving the performance. But also taking advantage of the fact that as physicians, we have to be part of the discussion and start collaborating also with companies and with the universities for shaping new tools that can be used, and why not being part of a business plan that can be actually part of our daily life. And the very last thing is that is for us that we are already âgé or vintage. We are transitioning into AI. The new generations of med students will start using AI from the very scratch. So it's our duty right now as urologists to test this technology and testing this technology to understand if it's useful, and therefore this technology be used from the urologist of the future.
It's a great conclusion. I just, the way that you described that just reminded me, I don't know, Gio, I don't know how old you are. I'm not going to age you or whatever, but what's interesting about our generation, at least, Kevin and I, is like, and you too. I mean, we were the first generation to really have personalized phones. We were the first generation to deal with like the internet. We were the first generation now to deal with, social media and like we're the first people to like grow up when it was coming in. Now the generations behind us have now experienced growing up with social media, the internet. It's a different world. So I don't know what it is about our generation. Maybe we are the golden era, or maybe I'm just biased, but it's a very interesting time for us to always be in that moment where there's a big technological change that we're facing at our front, right? And we have already seen the impact of growing up with social media, growing up on YouTube. Like, obviously, some of it's not that great. I mean, maybe I'm a little bit biased, but there are some really wonderful things as well. So it's just almost impossible to predict how this is going to impact us as physicians, impact patients, impact humans. I mean, it could go in a million different directions, and it's a pretty exciting time. But I also think, we have to be conscious and be very thoughtful. And that's why you're here, because we need people like you really thinking about it in a very critical way, so that the people like me and Kevin can just be minds off. And if I want to just learn about something on some kind of AI platform, I know it's a trusted source. But yeah, I mean, this was great. This was a really enlightening conversation. AI is very cool, very terrifying, honestly, from my perspective at the same time. But we're lucky that we have people like you thinking of it from a very critical way. So can you just give our listeners a little bit about yourself, like where they can find you, where you're located, and if they want to follow your work, because you are publishing on AI more than almost anyone I know, if not anyone I know.
That's why we had to start collaborating, so the three of us can publish more than anyone else. So yes, you can find me. I'm working at the USC, University of Southern California in Los Angeles. You can find me on my Twitter, which is at Cacciamani, Cacciamani, MD. And, I will be more than happy. Please reach out to me and we can have a discussion on AI. This was great. Thank you so much. Thanks to our listeners, as always. Check out the site, check out our YouTube. We recorded this so you can see our beautiful faces. And as always, subscribe on Spotify, iTunes, and Amazon. Thanks for listening. For all of us, have a good day.